Someone recently posted a question on one of my YouTube videos, and I'm going to just read that out here and answer that question. So it says, what treatment would you recommend for a tick-borne illness in a 12-year-old boy? I never gave my son Doxy. It's too hard to keep him out of the sun. He took Viaxin for a while, but he had side effects from that. He's taken Zithromax, which isn't very effective. He's now on teasel root extract. It doesn't seem to be working, and he's been chronically sick after a tick bite when he was 3 years old. So thank you for the question. I'm sorry to hear that your son's been struggling for so long. That's really rough for anyone, and especially in young ones, it's that much more sad. I mean, as per usual, I can't offer any clinical advice or any medical advice over social media. If you would like to chat with me about your son's case, by all means, please contact my front desk and book an appointment. Feel free to message me, and I'm happy to send you the contact information. But what I'll just mention a couple of things just for informational purposes only that hopefully will be somewhat useful. So what I found is that when it comes to treating pediatric patients who have tick-borne illness, the same types of herbs and same types of principles that we use in adult patients tend to apply. The differences are that I find kids usually need usually can get away with lower dosages of the herbs. Usually they get better faster than adults by and large when the right optimal treatment is in place. And what I've also, the other thing though, is that we sometimes have some limitations in terms of which herbs we can use with pediatric patients, depending on whether or not they can swallow pills or they can tolerate grosser tasting things like herbal tinctures, which are what I prefer to use with my patients. Not to say that you can't encapsulate herbal tinctures and get around the taste issue, but anyways, there's different approaches that can be taken. One thing that I will mention about teasel root, so teasel root has a fairly small amount of research that's been done on it with respect to Lyme. There has been one or two petri dish studies that looked at teasel root. I believe that in the one study looking at teasel root, it was actually using a sort of like a fat soluble extract from the teasel root, which would be quite a bit different than like a teasel root tincture, for example. But I really haven't seen a whole lot of clinical benefit from teasel root in my practice. I used it extensively in the past, and when I stopped using it, started using other herbs instead, I found that I got better results with other herbs. So I wouldn't list, in my experience at least, I wouldn't put teasel root as being very high on the list in terms of efficacy. I'd put it actually fairly close to the bottom of efficacy. And if anyone listening to this is thinking, hey, I used teasel root and it worked really well for me, fantastic. I'm not saying it doesn't work, I'm just saying in my experience, not the strongest herb in our armamentarium for going after Lyme and co-infections. Also in my experience, oftentimes we need to work with multiple herbs simultaneously to get the best results. So just using a single herb, sometimes works just great, but oftentimes we want to use multiple herbs because we really never know for sure how many co-infections we might be dealing with, whether there are viruses afoot, and then whether some of those herbs just might not be specifically effective against a particular strain of bacteria. So using multiple herbs tends to be more efficacious. When patients don't have a significant response to antibiotics and like a medication like Zithromax, it is indicated for Lyme, but really most of the research, or really virtually all of the research, is looking at using it in acute forms of Lyme or like in traditional Lyme disease, not the chronic manifestations of it. So it's not too surprising to hear that single antibiotic regimens might not be terribly effective for a patient, especially if they've had chronic symptoms for many years. So in many analogous cases, we need to make sure we have comprehensive herbal treatment in place. I mean, it's not to say that antibiotics couldn't be used, but usually one would need to work with a Lyme literate medical doctor and potentially be on multiple antibiotics or be rotating through or pulsing them. In my practice, I don't do, my patients generally are not working with antibiotics because they have a harder time getting them here in Nova Scotia, and we just are able to use non-pharmaceutical treatments to get our patients well in the vast majority of cases. So making sure there's an adequate antimicrobial regimen in place. And then also in many of the chronic cases that I work with, it's quite common that bringing in low-dose immunotherapy can be very helpful. And then also screening for other things that might be going on, like intestinal dysbioses or methylation cycle issues, or possibly different toxin buildups like mold toxins or heavy metals. So when patients are sort of struggling to get well after many years of having an issue, and if most of the treatments have been focused on, say, just tick-borne illnesses, then it can be a clue either that, or the writing on the wall is typically either that there hasn't been comprehensive enough treatment put in place, or there are other things that are going on beyond just the tick-borne illness. So I hope that this information is helpful. I hope that your son is feeling better soon. And if you or anyone else have any questions about or comments about this topic, please post in the comment section below. And otherwise, or if there are questions about anything else, please feel free to post, and I will answer as soon as I'm able to.